Stop drinking these 7 beverages that harm your heart. Doctors have spent decades warning you about fried food and fatty meals. But for your heart, the real danger might not be on your plate at all. It might already be sitting in your refrigerator, inside a glass you reach for every single day. There is a strong chance that at least one of the 7 beverages we are about to walk through, right now today, is quietly raising your blood pressure or straining your heart's natural rhythm. The very same drink your spouse, your children, or your closest friends might be pouring for themselves without a second thought. This video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If you have concerns about your heart health, it is always a good idea to speak with a qualified healthcare provider who knows your personal history. Here is something that might surprise you. Some of the beverages we consider harmless, even the ones marketed as healthy or refreshing, may be quietly working against your cardiovascular system with every single sip. And stay with us because later in this video we will talk about a beverage that many people drink daily, believing it supports their heart, when research suggests the opposite may be true for certain people. That one alone might change how you shop for groceries. Number 1. Regular soda and sugary soft drinks. There is a reason health researchers have spent decades studying the relationship between sugary soft drinks and heart disease. A single can of regular soda often contains somewhere between 35 and 40 grams of sugar, and for many people, one can rarely stays at just one. When sugar floods the bloodstream this quickly and this often, the body responds by producing more insulin, and over time, elevated insulin levels have been associated with higher blood pressure, increased triglycerides, and inflammation in the blood vessels. All 3 of these factors may be associated with a greater risk of heart disease. Consider someone like Carol, a 62-year-old teacher from Ohio who told her doctor she thought she was doing everything right. She avoided fried food, she walked every morning, and she genuinely believed her 3 daily glasses of cola were simply a harmless habit, almost a reward for her discipline elsewhere. When her cardiologist reviewed her blood work, her triglyceride levels were notably elevated. It wasn't a dramatic moment, no alarms went off, but it was a quiet reminder that heart health is often shaped by small, repeated choices rather than single dramatic events. Her doctor explained that consistently high sugar intake, even from something as ordinary as soda, may contribute to changes in blood vessel function over the years. This is why so many cardiologists ask about beverages first, not just meals, when reviewing a patient's daily habits. It is not simply about sugar itself, but about how frequently the cardiovascular system is asked to process large sugar loads. And that pattern of repeated stress on the body is something we will see again and again as we move through this list. There is also a less obvious factor at play here, one that often gets overlooked in casual conversations about sugar. Liquid sugar tends to be absorbed differently than sugar consumed alongside solid food. Without fiber or fat to slow digestion, the sugar in a soda enters the bloodstream rapidly, causing a sharper spike in blood glucose than a comparable amount of sugar eaten in, say, a slice of cake after a meal. Some researchers believe this rapid spiking pattern, repeated multiple times a day, may place additional demands on the pancreas and on the blood vessels lining our circulatory system. Over years, this repeated demand is one of the mechanisms researchers point to when explaining the associations found between sugary drink consumption and long-term cardiovascular risk. Number 2. Energy drinks. Energy drinks are marketed as a quick solution for fatigue, focus, or a demanding schedule. And for many people, especially those working long hours or studying late into the night, they have become part of a daily routine. However, most energy drinks combine 2 ingredients that together may place additional strain on the cardiovascular system: high amounts of caffeine and significant added sugar, often alongside other stimulant compounds. A typical energy drink can contain anywhere from 150 to over 300 milligrams of caffeine in a single serving, which is considerably more than a standard cup of coffee. When consumed quickly, as many people do, this level of caffeine may cause a rapid increase in heart rate and blood pressure. For most healthy adults, this effect is usually temporary. But for individuals with an existing heart rhythm irregularity, or those who are unaware they have one, this sudden spike may be more significant than expected. There have been documented cases, discussed in various medical journals, describing emergency room visits linked to heart palpitations following the consumption of multiple energy drinks in a short period. This does not mean energy drinks are dangerous for everyone who drinks them occasionally, but it does suggest that repeated high-volume consumption, especially several cans in a single day, may be worth discussing with a healthcare provider, particularly for anyone with a personal or family history of heart concerns. What makes energy drinks especially worth mentioning is how normalized they have become among younger adults, a group that may not typically think of heart health as something relevant to them yet. But cardiovascular strain does not always wait for middle age to begin showing itself. There is another layer to this conversation that rarely gets discussed. Caffeine sensitivity varies enormously from person to person, largely due to genetic differences in how quickly the body metabolizes it. Some people can drink an energy drink and feel little more than mild alertness, while others, due to slower caffeine metabolism, may experience a much more pronounced and prolonged effect on heart rate and blood pressure from that exact same can. This variability is part of why some individuals experience noticeable symptoms after a single energy drink, while their friend, drinking the identical product, feels completely fine. It is also part of why blanket statements about energy drinks being universally safe or universally dangerous tend to miss the more complicated reality, one where individual physiology plays a significant role. And that brings us to something people often drink because they believe it is the healthier alternative to soda. Number 3. Sweetened bottled iced teas. Many people switch from soda to bottled iced tea because it feels like a more sophisticated, more health-conscious choice. Unfortunately, most mass-produced bottled teas contain sugar amounts that rival or even exceed those found in soda. A single bottle may easily contain over 30 grams of sugar, sometimes more, depending on the brand and flavor. The issue here isn't the tea itself. Tea, in its unsweetened form, actually contains beneficial plant compounds called polyphenols, which have been studied for their potential positive effects on blood vessel function. The problem arises when tea becomes a vehicle for large amounts of added sugar, essentially neutralizing or even outweighing any potential benefit the tea itself might offer. Think about someone like Richard, a 68-year-old retired mechanic who replaced his afternoon soda with what he thought was a healthier iced tea, believing the word tea on the label meant it was automatically a better choice. It took a routine physical and a conversation with his physician about his slowly rising blood sugar for him to realize the switch he made hadn't actually reduced his sugar intake at all, it had simply changed its packaging. This is an important pattern worth remembering as we continue through this list, because several of the beverages on it are widely perceived as healthy alternatives, when in reality, they may carry very similar risks to the products they were meant to replace. Part of the challenge here comes down to how these products are marketed and displayed. Bottled teas are often placed near the health food section of grocery stores, packaged in earth-toned bottles with images of green leaves, words like natural or antioxidant-rich printed prominently on the front. Meanwhile, the nutrition label, which tells the more complete story, sits quietly on the back, in far smaller print. Taking a moment to actually read that label, rather than relying on the front of the packaging, is one of the simplest and most practical habits anyone can adopt when trying to make heart-conscious choices at the grocery store. Number 4. Sweetened fruit juices and juice cocktails. Fruit juice occupies an interesting space in the conversation about heart health, because whole fruit itself is generally associated with numerous health benefits, including fiber, vitamins, and antioxidants that may support cardiovascular wellness. However, once fruit is juiced, much of its fiber is removed, and what remains is often a concentrated source of natural sugar without the elements that would normally slow its absorption into the bloodstream. Many commercial juice products go a step further, blending small amounts of real fruit juice with large amounts of added sugar, sometimes labeled as juice cocktails or juice drinks rather than 100% juice. These products can contain sugar levels comparable to soda, while still benefiting from a health-conscious marketing image built around fruit imagery and words like natural or vitamin-enriched. Research has suggested that regularly consuming large quantities of sugar-sweetened beverages, including fruit juice, may be associated with increased triglyceride levels and higher blood pressure over time. This does not mean an occasional small glass of 100% fruit juice is harmful for most people. But it does suggest that treating juice as a beverage to be consumed freely throughout the day, the way one might drink water, may not align with heart-healthy habits. To put this in perspective, imagine eating 3 whole oranges in one sitting versus drinking a single glass of orange juice made from those same 3 oranges. The whole fruit takes time to chew, contains fiber that slows sugar absorption, and tends to be more filling, making it harder to overconsume in large quantities without noticing. The juice, on the other hand, can be consumed in under a minute, delivers all of that sugar at once, without the fiber that would normally moderate its effect on blood sugar, and rarely leaves a person feeling as satisfied. This difference, subtle as it may seem, is one of the more important distinctions in understanding why whole fruit and fruit juice, despite coming from the same source, may affect the body quite differently. Now here is where things start to become a little more unexpected, because the next beverage on our list is one that many people specifically choose because they believe it is the safer, more elegant option when eating out or relaxing at home. Number 5. Sports drinks consumed without physical exertion. Sports drinks were originally formulated for athletes engaged in prolonged, intense physical activity, individuals who lose significant amounts of sodium and other electrolytes through sweat. For that specific purpose, these beverages can serve a genuinely useful role. The concern arises when sports drinks are consumed casually, by people who are not engaging in extended vigorous exercise, simply because the drink is perceived as a healthier alternative to soda. Most sports drinks contain both added sugar and elevated sodium levels designed to replace what athletes lose during exertion. When consumed by someone who is largely sedentary or only mildly active, these ingredients are not being used for their intended physiological purpose. Instead, the body may be taking in unnecessary sugar and sodium, and consistently high sodium intake has long been associated with increased blood pressure, one of the most significant risk factors for heart disease. Consider Linda, a 59-year-old office administrator who began drinking a sports drink daily, believing it would help her stay hydrated throughout her workday. She wasn't training for a marathon or working outdoors in extreme heat. She simply liked the taste and the bright packaging that suggested vitality and health. During a routine checkup, her physician noted a mild increase in her blood pressure, and after reviewing her daily habits, gently pointed out that her sports drink, consumed without the physical activity it was designed for, may have been contributing more sodium and sugar to her diet than she realized. This example highlights something important, that a product's intended use matters just as much as its ingredient list. A drink is not automatically heart-healthy or heart-harmful in isolation. Its effect often depends on how, when, and why it is being consumed. From a physiological standpoint, sodium plays a very specific role in the body. It helps regulate the amount of fluid held within blood vessels. When sodium intake is higher than the body actually needs, the body tends to retain additional fluid, and this added fluid volume can increase the pressure exerted against the walls of blood vessels. Over time, this consistently elevated pressure, if it persists, has been associated in research with increased strain on the heart and blood vessels, potentially contributing to long-term cardiovascular changes. This is precisely why healthcare providers so often ask patients not just about the food they eat, but about seemingly small daily habits, like a sports drink enjoyed during a lunch break at a desk job. Far removed from the athletic performance context these products were originally designed around. Number 6. Sweetened specialty coffee drinks. Coffee itself, in its plain black form, has actually been the subject of research suggesting potential cardiovascular benefits when consumed in moderation, largely due to its antioxidant content. However, the coffee many people drink today looks very little like plain black coffee. Specialty coffee drinks, the kind topped with whipped cream, flavored syrups, and sweetened milk, can contain surprising amounts of sugar and calories, sometimes comparable to a dessert. A large sweetened specialty coffee drink can contain anywhere from 40 to over 60 grams of sugar in a single serving, along with significant amounts of saturated fat depending on the type of milk or cream used. When this becomes a daily habit, rather than an occasional treat, the cumulative effect on blood sugar regulation, cholesterol levels, and overall caloric intake may be considerably more significant than most people realize. This is precisely the beverage we mentioned earlier in the video, the one many people drink daily while believing it supports their overall wellness, perhaps because it contains coffee, an ingredient often associated with health benefits. The distinction lies in what has been added to that coffee. A daily habit involving a large, heavily sweetened coffee beverage may, over months and years, contribute to some of the very risk factors that plain coffee has been studied for potentially helping to reduce. It is a subtle but important distinction, and one that speaks to a broader theme running through this entire video: the idea that a beverage's reputation and its actual nutritional content do not always align. Consider Margaret, a 65-year-old grandmother who visited a coffee shop every single morning before starting her volunteer work at a local community center. She ordered what she considered a small treat, a caramel-flavored coffee drink topped with whipped cream, believing that because it contained coffee and milk, it fit reasonably well within a balanced lifestyle. When her nutritionist walked her through the actual nutritional breakdown of that daily drink, factoring in the syrup, the whipped topping, and the type of milk used, she was genuinely surprised to learn it contained nearly as much sugar as a candy bar. Margaret didn't need to eliminate her morning ritual entirely, but she did begin asking for less syrup and swapping the whipped cream for a lighter alternative, small adjustments that preserved the enjoyment of her routine while reducing its impact on her overall sugar intake. Number 7. Excessive alcohol consumption. We arrive now at a beverage category that deserves particular care and nuance, because the relationship between alcohol and heart health has been widely discussed, sometimes with conflicting messages. For years, some research suggested that very moderate alcohol consumption, particularly red wine, might offer certain cardiovascular benefits. However, more recent and more rigorous research has led many health organizations to reconsider this position, suggesting that the risks associated with alcohol consumption, even at moderate levels, may outweigh any potential benefits for most individuals. What is more clearly established is the impact of excessive or frequent heavy alcohol consumption on the heart. Regularly consuming large amounts of alcohol has been associated with elevated blood pressure, irregular heart rhythms, and in some cases, a weakening of the heart muscle itself, a condition sometimes referred to as alcohol-related cardiomyopathy. Binge drinking, defined as consuming a large amount of alcohol in a short period, has also been linked in research to a temporary but sometimes serious disruption in normal heart rhythm, occasionally described informally as holiday heart syndrome due to its association with celebratory drinking occasions. Consider the story of Harold, a 71-year-old retired firefighter who described himself as a social drinker, someone who never felt he had a problem, but who acknowledged that gatherings with friends often meant 4 or 5 drinks over the course of an evening, a pattern that had quietly repeated itself for years, particularly around holidays and weekend get-togethers. After experiencing an episode of noticeable heart palpitations following one such evening, his physician discussed how the cumulative and occasional heavy use of alcohol, even without daily drinking, may still place meaningful strain on cardiovascular health over time. This does not mean every person who enjoys an occasional drink is at risk, and individual circumstances vary considerably. However, it does suggest that conversations about alcohol and heart health are more nuanced than simply asking how often someone drinks, and may also involve how much is consumed at any single time. It is worth acknowledging that this shift in scientific understanding can feel a little confusing, particularly for those who remember hearing, years ago, that a daily glass of red wine might actually help their heart. Science evolves as research methods improve, and larger, more carefully designed studies conducted in more recent years have allowed researchers to look more closely at alcohol's effects across large populations, accounting for other lifestyle factors that earlier studies may not have fully considered. This evolving understanding is a normal part of how medical science progresses, and it is one of the reasons ongoing conversations with a personal healthcare provider tend to be more valuable than relying on general information alone, since your provider can weigh your specific health history against the most current evidence available. Bringing it all together. As we look back across everything we've discussed, a clear pattern begins to emerge. It is rarely a single beverage consumed once that meaningfully affects heart health. Instead, it is the quiet, repeated pattern, the daily soda, the routine energy drink, the sports drink consumed without exercise, the specialty coffee treated as a daily necessity rather than an occasional indulgence. These small, consistent choices made day after day may accumulate in ways that are easy to overlook precisely because no single instance feels significant on its own. One especially notable statistic worth remembering from research on sugar-sweetened beverages suggests that individuals who consume these drinks regularly may face a meaningfully higher risk of cardiovascular-related health concerns compared to those who consume them rarely or not at all. That statistic alone is a powerful reminder that what we drink deserves just as much attention as what we eat. None of this means you need to eliminate every beverage mentioned today completely or permanently. Moderation, awareness, and understanding why a particular drink might affect your body the way it does. These are far more sustainable approaches than strict, all-or-nothing rules that are difficult to maintain over time. If any of this resonated with your own daily habits, it may be worth having a conversation with your healthcare provider about your personal risk factors and what changes, if any, might be appropriate for you. If you are looking for a practical starting point, many nutritionists suggest a simple approach rather than an overwhelming overhaul. Start by identifying just one beverage from today's list that you consume most frequently, and consider gradually reducing how often you reach for it, rather than eliminating it overnight. Small, sustainable adjustments, like replacing one sugary drink a day with water, unsweetened tea, or black coffee, tend to be far easier to maintain over months and years than dramatic changes made all at once and abandoned within a few weeks. Reading nutrition labels, paying attention not just to sugar content but also sodium and serving size, and staying curious about how these ingredients might interact with your own personal health history. These habits, practiced consistently, may do more for your long-term heart health than any single dramatic change ever could. It is also worth remembering that heart health is shaped by many factors working together, not by any single beverage or food in isolation. Physical activity, sleep quality, stress management, and regular checkups with a healthcare provider all play meaningful roles alongside dietary choices. Thinking about beverages as one piece of a much larger picture, rather than the sole determining factor, tends to lead to a healthier, more balanced relationship with food and drink overall. We would genuinely love to hear from you. Which of these beverages surprised you the most, and is there one you might reconsider after watching this video? Let us know in the comments below. Your experiences and questions often help shape the topics we cover in future videos. If you found this information valuable, consider sharing it with someone in your life who might benefit from hearing it. A parent, a friend, or anyone who might be reaching for one of these drinks without realizing its potential impact. And if you'd like to continue learning about practical, evidence-informed ways to support your heart health, consider subscribing so you don't miss what we cover next. Thank you for spending this time with us, and we'll see you in the next video.